Back to WMBC News. Joining me today is Dr. Thomas McCarrick. He's a primary care physician here to discuss the coronavirus. Doctor, thank you so much for joining us.
Happy to be here.
So as the coronavirus crisis continues to unfold, there are certain populations that are more susceptible to the virus, the elderly and the immunocompromised. What precautions should this population take to prevent getting the infection?
I think that's exactly the point, is that they should try to prevent getting the infection. The infection it's spreading in the community. It's going to spread more among people who have close contact. So you're hearing a lot about social distancing. It's the idea that you want to try not to be in an environment where there could be somebody around you who's sick. So the precautions that the elderly should take is really around not being in large groups where there might be somebody around them who's sick. Avoiding places where large groups are congregating. So unfortunately, that could be churches, it could be the senior center, it could be other senior activities. A lot of seniors like to go to Broadway shows. So I'm sorry, right now, you really should be thinking about avoiding those situations where there could be somebody around you and you can't escape when somebody coughs or sneezes in your direction.
And I want to change the focus and shed some light on the caregivers for the elderly. These patients are taking care of the immunocompromised patients. What precautions should they take?
I think the thing that they need to be most conscious of is not getting the infection themselves. So even though you could have a young person who is not high risk to get seriously sick from coronavirus, if they are in an environment where they are around lots of other people and other folks around them are sick and they bring it home, now they've just brought the virus into the house and they've exposed somebody who's really vulnerable. So I think if you're a caregiver for an elderly person, somebody over age 60, 65, certainly 70, 80, and you really are responsible for hands-on care and feeding them their meals, then you should be taking those same precautions as if you were that elderly person themselves. So not to be in social situations where there are a lot of folks around, obviously staying away from anybody who's sick, even if they seem to have a minor infection like a cold. We don't really know right now. That could be just a mild case of coronavirus. So I think that's the first best way that you can protect the people near you who would be susceptible.
And unfortunately, there's no treatment or therapy or vaccine for the coronavirus. There only seems to be symptomatic treatment. So somebody that is positive and has the infection, what should they do? How do you make them feel comfortable?
I think the first thing we want to do is actually assess their risk. So if it's a young, healthy 30-year-old who has the infection, they need to just stay home, take it easy. The main point is actually not spreading it to somebody else. Whether they do anything or not is probably not going to make much difference in their own recovery. They're going to get better no matter what. But we do encourage them to stay warm and dry, stay hydrated, use a fever reducer if they have a fever, or take something like Tylenol for body aches. But that's really just symptomatic treatment. The main thing we want them to do is not to spread it to anyone else, and particularly not to spread it to anybody who is over age 60 or has some health condition like diabetes or lung disease or heart disease.
There's a lot of comparison between the coronavirus and the flu virus. How do you differentiate the symptoms of each?
You really can't. The symptoms are very similar, but they're also similar to the common cold. Someone who gets a young, healthy person who gets a mild case of coronavirus may have very minimal symptoms, a runny nose, slight cough, almost nothing, something that would just think this is just a common cold. And we can't really differentiate. I think, fortunately, as we get out of the real flu season, which is typically the fall, winter, and early spring, the prevalence of flu in our communities is decreasing. So it would be very confusing if we were facing this crisis and it was December, January, February. We're still doing flu tests. If folks come in and they have symptoms that appear to be flu, we're still testing them first. And ironically, we're saying, if you have a positive flu test, we're saying, hooray, you have the flu. It means you don't have coronavirus. So that seems a little paradoxical. But you can't differentiate clinically. The symptoms are the same.
The flu vaccines, do they have any immunity against the coronavirus?
There's no vaccine for coronavirus. Coronavirus is really, this strain, this type of coronavirus is really a new It's a new virus, and that's part of the reason that it's spreading, is that none of us have any protection against this infection. It's completely new to us. It does not cross over with the flu at all, so there's no protection from the flu vaccine. People who get the flu vaccine every year, even when the vaccine is not a perfect match, the viruses are kind of similar. So many times, from either having had the vaccine or having had previous flu, you have some antibodies in your system that will give you some partial protection. With coronavirus, we are unfortunately completely bare, but there's definitely no protection from a flu shot or even a pneumonia vaccine.
How are you protecting yourself and your staff when you treat patients?
We are going to great lengths to protect ourselves, because if we cannot protect ourselves and we get sick, we can't take care of our patients. So that's a super high priority in the practice. And we are, maybe, it might seem we're going overboard. We're not going overboard, but it may appear that way. So we've done things in the practice like we have patients are seen separately. Sick patients, anyone with a cough or cold, flu symptoms, is seen separately. They don't come into our waiting room. They come in a side door. We have equipment. It's called PPE, personal protective equipment. So we have these special masks. They're not the surgical masks. It's a special high filtration mask. We have a face shield. We have a special type of gown on. We wear gloves. And so we do this for the protection of everyone. It's the protection of ourselves so that we don't get infected. It also protects other patients in the office. We want folks to be reassured that they can come to our practice for their blood pressure check, or because they have back pain or a physical. They can come to our practice and they're not going to be exposed there to coronavirus. So we have a separate part of the building where this is managed, separate hours, separate staff.
That's really good information, and that's good to know. I want to end the interview with some words of wisdom from a medical perspective. What do you tell a patient that's losing sleep over this?
Don't panic, be prepared. The more you know about this, the better you will be able to actually reduce the risk of infection. There's a lot of craziness going on with people doing things that are not really rational or really helpful. So I think try to understand what's going on. Go to the CDC website, look at the information there for patients. I think it's really important that you use a good source of information. Do not go to Facebook or Google for your information, because there's so much misinformation, you'll become confused and you will also get wrong information. So go to the CDC, which is probably the best source. Look at the patient information there. Understand about this. The more that you understand about this, the better you can protect yourself, and more importantly, the more that you can protect the people around you who would be vulnerable.
Thank you so much. Thank you for joining us.
We have been in conversation with Dr. Thomas McCarrick, primary care physician. WMBC News will be right back.